Coming up, aging matters, disparities, and health equity.
Because the heart ain't nothing to play with. And see, my mother died from congestive heart failure. So,
after generations of inequities, America's healthcare system faces a reckoning in the midst of the coronavirus pandemic.
It's hitting Black and brown people more than usual, those who have pre-existing conditions. And if they didn't have them under control, why is that, right?
I have no insurance. So, paying for labs and different specialists, I just don't have that to do.
How do we deal with people's real life constraints? And we're not always playing catch up.
But then you got to understand the system, and that's very difficult.
For older adults, systemic inequities over a lifetime compounded by ageism is deadly. Life expectancy has steadily decreased since 2014, especially among Black and Hispanic adults.
You have to show proof that you have something wrong with you in order for you to get the medicine. And I maintain, if I was white, I wouldn't have to go through that.
Major funding for Aging Matters is provided by the West End Home Foundation, enriching the lives of older adults through grant-making, advocacy, and community collaboration. The Jeanette Travis Foundation, dedicated to improving the health and well-being of the Middle Tennessee community. The HCA Healthcare Foundation, on behalf of TriStar Health. Cigna, together all the way. Additional funding provided by Jackson National Life Insurance Company, the Community Foundation of Middle Tennessee, and by members of NPT. Thank you.
There's an old saying among African Americans that goes like this: when white folks catch a cold, Black folks get pneumonia. That adage is now backed up by clear evidence in the fight against COVID-19. The pandemic poses hardships for everybody, but Black people and other people of color are being devastated much more. It's a pattern well documented for years that people of color fare worse than their white counterparts in health conditions like cancer, diabetes, heart disease, hypertension, and obesity. The question is why? Hi, I'm Kathy Mattea. In this edition of Aging Matters, we'll explore the reasons for racial health disparities. How do disparities during a lifetime impact health as we grow older? What are the barriers to health care that result in disparities? What is being done to improve access, trust, and knowledge about quality health care? Join me as we look deeper than skin color to learn about the causes of health disparities and their impact as we age.
Congratulations.
Thank you.
Hello there. How you doing? Second shot?
Rarely have so many Tennesseans been so happy to get a jab in the arm, a vaccination shown to prevent the deadly COVID-19 virus. People like 87-year-old Bernadine Fleming are making big plans to live normal again.
Hello there. Hey. Don't you look pretty in all your red? Just beautiful.
Now, I'm not a club hanger or anything, but I must get out of the house. That's a must. I don't care how I get out, but I must get out.
Her daughter, Allison, made all the arrangements for Bernadine to be on the schedule when Nashville Health Department offered COVID vaccinations to people 75 and older.
I was going to make sure that at some point she was getting this vaccine.
You got it, lady.
It's been worrisome. I don't want anything to happen to her as it relates to COVID-19. I would, see the media talk about all the deaths.
And we are talking about the surge in coronavirus cases.
The deaths among African Americans in disproportionate numbers to their population.
Black, Hispanic, and Native Americans are still being disproportionately infected, hospitalized, and killed by the virus.
More than 500,000 Americans had died from COVID-19 by March 2021, just 12 months after the virus was declared a pandemic by the World Health Organization. The shocking death toll continues to grow and reveals disturbing demographics. According to the Centers for Disease Control, almost 80%, that's 8 out of 10 deaths from COVID-19 have been people 65 years and older. Compared to white people, American Indian, Alaskan Native, Hispanic, and Black people have greater risk of dying from COVID-19.
This future obviously dark. This future obviously ours. This future obviously dark.
The COVID-19 disparities by race, age, and social factors are a clarion call to the U.S. healthcare system, a warning some have been sounding for generations.
This isn't new. This is another health condition that will disproportionately impact those that are the most disenfranchised and racial and ethnic minorities.
I think it's convenient for her to get there. It's just that it's...
Dr. Imalohi Ahankai is an infectious diseases physician and public health researcher at Vanderbilt Medical Center. She has spent years sounding the alarm about racial disparities in healthcare, and she sees many medical and social parallels between her specialty, HIV/AIDS, and COVID-19. Fear, uncertainty about transmission, unfolding disparities by race and ethnicity. The result is often poor quality of life and health as someone grows older, if they grow old at all. According to the National Center for Health Statistics, life expectancy had been increasing until 2014, when it started decreasing in small bits. And in 2020, the onset of COVID-19, things fell off a cliff. Life expectancy in the U.S. dropped a whole year, from 78.8 years to 77.8. And whose life is shortest? Hispanic and Black people, with declines of almost 3 years and 2 years respectively, from 2019 to 2020. Could racism, either overt or implicit, be a factor? Yes, according to recent studies.
One study that looked at Black men, older Black men, who experienced depression and reported more experiences with racism over time, had inflammation in the brain that can be a setup for strokes. There's another study looking at something similar in chronic kidney disease for women. So women who were minorities and reported more experiences with racism also had worsening progression of their kidney disease.
And there was a Dr. Castle.
That's okay.
Yeah, because the heart ain't nothing to play with. And see, my mother died from congestive heart failure, so.
No matter the disease, Dr. Ahankai squelches any notion that health disparities are caused by skin color or genetics.
The more we understand about genetics, we recognize that the meanings that we've conflated with race are not about genetic differences. They're about social differences. They're about the differences that we've attributed to them. And so we can't say that this is in their DNA. We have a lot of other historical data that tells us what is driving some of those differences, and that's when we talk about the social determinants of health.
She gives 6 major social determinants that impact health: economic stability, food security, physical environment like zip code and housing, education including misinformation and language barriers, community and social context like isolation and discrimination, and the healthcare system, or lack of access and inequities in care. During a lifetime, these barriers can limit opportunities, and for older adults, they greatly impact health and quality of life, including the ability to live independently and age in place.
We need to create systems that help to ensure that the way care is delivered is consistent across the board. But we also need to listen. We need to listen to our patients.
This is the second worst day. The doctor wanted to send me home. He said, you don't need it. You're not even short of breath. I said, yes, I am. I was in so much pain from my neck. My neck hurt so bad. was crushed. He made me feel like I was a drug addict, and he knew I was a physician.
Dr. Susan Moore, a 52-year-old family physician, posted this selfie on social media in December 2020 from her hospital bed in Indiana. The video went viral and became an indictment against racism and cultural bias in healthcare after Moore alleged substandard treatment due to her race.
This is how black people get killed. When you send them home and they don't know how to fight for themselves. I had to talk to somebody, maybe the media, somebody, to let people know how I'm being treated up in this place.
She died a few days later from COVID-19. The hospital where Dr. Moore was treated launched an external review that was finalized in May 2021. It found the medical care she received did not contribute to her untimely death. However, there was a lack of empathy and compassion shown in the delivery of her care, and cultural competence was not practiced by all providers, and several caregivers lacked empathy, compassion, and awareness of implicit racial bias.
If we get back to the issue of listening to the patient, she told him what was wrong. Even if she were not a physician, she told him, but instead, layered on that were all these assumptions about who she was and why she was asking for what she was asking for, and it's heartbreaking. I'm not saying that there is no individual responsibility in health. That would be foolhardy, but people are operating within a system that is available to them. And so I think we have to be very mindful of the system that we've created and that it's not the same for everyone.
American medicine has a deep-rooted, troubled racial history. For example, the Tuskegee study that began in 1932 using black sharecroppers without their knowledge. The men were diagnosed with syphilis and were not given treatment to see how sick they would get. In the case of Henrietta Lacks, an African-American woman whose cancer cells were collected in 1951 without her consent or payment. Her cancer cells to this day are one of the most important sources of medical research data. The medical abuses include unwilling and sometimes undisclosed experimentation, sterilization, grave robbing, and malpractice linked to social Darwinism and eugenics. That history is well documented, but it is present-day incidents like Dr. Susan Moore's that are creating distrust and hesitancy among patients of color.
There was a study published in the American Journal of Public Health that looked at 15 studies looking at implicit bias in medicine. And they said, yes, physicians tend to have a negative bias towards blacks, a positive bias towards white. It impacts treatment decisions and it impacts patient outcomes. COVID was the perfect storm to bring these issues to a platform that allowed discussion on such a broad scale. I think this is an area that will get more and more attention, really trying to understand what is the impact of these day-to-day living while minority stresses and burdens on individuals.
There's a lot of people that needs surgeries. There's a lot of people that needs dialysis, and they don't have access to that. People do wait till the problem is in the highest level. That they come here thinking that we are a clinic and we can help on that moment, and we can't. We just are the connection, you know.
Monica Reyna is director of Hispanic Family Foundation in Nashville, a nonprofit that assists the large and growing Hispanic population in Middle Tennessee. Today, it's a COVID-19 vaccination event.
One of the barriers that we see here in the Latino community, first of all, is that they are afraid to go downtown. One of the first questions that we are seeing in the phone calls is ICE gonna be there? That is one barrier. The second one is the transportation.
The barriers are even greater for those who do not speak English, like Wilfredo Guzman.
We always need someone to help us with the translation of English. To have health coverage, there are Hispanics that don't have social. So we do not have the access to health centers. It would be very interesting and nice for all immigrants to have that ease for the well-being of people as well as the communities of the country.
One of the things that's really important, especially for racial and ethnic minorities that are older, is lack of familiarity with the healthcare system in general, intensely distrustful, and for good reason. So how do we respond to that in a way that's sensitive? And how do we respond to it in a way that's actionable and is moving the ball forward? So making sure that patients understand we're not going anywhere. You can count on us. Oh, and if you lose your insurance, it happens. You can still come here.
Neighborhood Health is one of the largest safety net providers in Tennessee with 11 locations. CEO Brian Hale says they have only one requirement for patients to receive medical care.
If you have a pulse, you can be our patient, and that's it. All we require is a pulse. I'm not interested in figuring out your legal status. Our issue is, how's your hypertension? What's your diabetes look like? How are you managing your sugar? What we're trying to do is help people get ahead of those social determinants, and we're not always playing catch up.
I feel like I've neglected some things, and maybe they've gotten worse since between the time my insurance lapsed and now.
Hello. Hi, Miss Page. How are you? I'm doing good. I'm Latrina. I'm the nurse practitioner. I'll be seeing you today.
Yes, ma'am.
Nice to meet you.
It's a blessing in itself to have somewhere to go, to have somewhere where you feel comfortable and feel like you can talk to those, without any consequences or circumstances.
And then after that, we'll step out the room and we'll let you get undressed so we can proceed with the rest of your exam, okay?
This is a no judgment zone. It brings up the whole thing of trust. We may think that's not a barrier, but for some people it is, because they'll come to the doctor and they won't exactly say how they feel it or what's bothering them because they're afraid. They're afraid of being judged, or they're afraid that they won't get the care that they need.
Nurse practitioner Latrina Blakemore says bedside manner before treatment can make for better health care and a patient who is more willing to follow doctor's orders, so to speak, especially when language or culture impact the process.
We see people from all different nationalities, cultures. So I asked them, is there anything in particular that you are expecting? Is there anything that I shouldn't be doing that may make you feel uncomfortable? We have patients that sometimes have to have someone present or they don't like direct eye contact. Once I know, I'm gonna make an effort to show you that, hey, I respect you, I respect your culture, and I respect our differences.
The goal is to generate trust, confidence, so that patients are willing and able to comply with the care they receive.
The outcome could be that they take their medicine, which in turns can lead to lower blood pressure, which can lead to a better A1C for their diabetes.
And what happens when you take hydrocodone?
It hurt my stomach, and I was up for like 48 hours.
I hope out of this culture right now that we're experiencing with medical care or the lack of medical care is that we build this community of safety, of trust. It starts in our education in the colleges. We need to start programs there that's teaching you from the door what to look for, what to expect, how to treat everybody equally.
When student doctors graduate, they swear an oath that is rooted in the ancient medicine of Hippocrates. But a new generation of doctors is treating the professional oath like a patient that needs healing in a time of social reckoning.
I will seek to repair historical harms and confront current prejudices.
We'll uplift our communities,
magnify their voices, and advocate for health equity and justice.
And perform no operation without justifiable purpose.
I think my generation and the Gen X generation have kind of decided to blow up everything that we didn't like. So I do think my generation will make an impact because we've been making impact since we got put on the planet, right?
Morgan Williams is a first-year student at Meharry Medical College. She's not waiting for a diploma to help cure the causes of health disparities.
I think healthcare is a human right, right? I think everyone should have access to it, no matter where they come from, no matter what their demographic is, their race, their gender, cis, trans, I don't care. I think you should have access to it. If we can just make it easy for you to get the access that you need, then your life could be changed forever. Hi guys, I'm Morgan. I'm your ED tonight. So we have 4 patients. We have 1 Spanish-speaking patient who's gonna be with our interpreter. So remember, when you have your interpreter, you talk to your patient, not the interpreter. Tina, you will be with Terry. Kadeen, you will be with Marielle.
Williams directs the student-run Salt Wagon Clinic at Meharry. She and about 30 other student doctors volunteer their time outside of classes to provide free medical care under the supervision of a licensed doctor.
Put your hands together like you're praying and push. And does that cause that same pain?
You can feel the stiffness.
Okay, it just feels stiff? All right.
Mary Frances Sawyers has been coming to this clinic for years to manage her blood pressure. She doesn't have health insurance.
The students are wonderful. They accept me no matter what. So it ain't necessary by having everything free. It's being able to see a doctor willingly. It's all about the quality of people that you're around, good doctors.
You also do see the patients that are a little apprehensive because we're med students. And that's a hurdle to get over, but it's also, they recognize that they're getting the best care humanly possible because we check, we double check, and we triple check because we don't want to be wrong.
These students are also carrying on a legacy linked to their school's origin, the story of Samuel Meharry, who along with his brothers founded the college in 1876 to educate black doctors. It was a promise Meharry made years before when his salt wagon overturned on a country road and a family of freed slaves came to his rescue.
If we at Salt Wagon can be that one niche to be, let's get this under control so that you don't get hit by COVID or you don't get hit by the next epidemic or pandemic, that's literally why we're here.
Hello there. First dose or second dose?
First dose.
Congratulations.
Black people have kind of a myth about health care, how they feel about it. A lack of trust, a lack of trust. But for those who are out there, who are younger than I am, it's a gift. I want to say to you that this is a gift and you need to take advantage of it.
Now fully vaccinated against COVID-19, Bernadine Fleming feels her life is getting back to normal.
All righty, little girl. Hey, girl. Hey, I see that little tongue, girl. Oh, I love to get out on a day like this. The sun is shining, it's warming.
This 87-year-old retired nurse has seen many advances in medicine. She also knows its history of racism.
I'm probably one of the first black registered nurses that was hired at St. Thomas Hospital. But not to be seen, I worked in the operating room. So you're not seen in an operating room, you're totally masked. So nobody knows who anybody is. Those were the days of segregation. Now we've come a mighty long way since those days. But then you got to understand the system, and that's very difficult. It plays into the care of the people. We have not gotten out of discrimination. We may think that we have, but we have not.
George Floyd! George Floyd! George Floyd! George Floyd! George Floyd! George Floyd!
The peace our community deserves is going to come because we transform our conditions through community organizing. Y'all feel that? All right, and so I'm so grateful again.
The racial and social awakening in this country during a pandemic prompted by violence and policing against people of color is also forcing a reckoning within America's healthcare system to address the impact of racial malpractice and socioeconomic injustices.
With this dawning about this moment that we're in, is we're becoming aware of just how many assumptions that we've made, some about race, but often about other things as well. If we're really committed to being anti-racist, what does that mean? And does it stop with race? And the answer is, we've got a lot of work to do, but at least we're asking some more thoughtful questions.
So the Social Vulnerability Index is a measure developed by the CDC.
I realized that there are some very credentialed, well-meaning individuals in healthcare who simply do not get it. And so I really use this opportunity to try and be effective in teaching and educating people about what structural racism in medicine is, and so that we can all be on the same footing when we talk about this.
And most of us have lived through this year the trauma of George Floyd's murder. And I have to admit that to this day, I have not watched that video. I have 2 little boys who are pictured here. I have a Black husband, I have a Black father, and I was not capable of watching yet another video of a Black man being violently killed in this country.
This is a part of our experience. So really giving a window into what our lived experience is, I think for some people is helpful. There's no reason for them to have thought about it otherwise.
Dr. Ahankai is seizing this moment to speak truth about health inequities and her profession's role in leveling the field.
I'm hoping that it has allowed us to accept that common language as a platform for us to continue to build interventions and change. And when we talk about structural solutions to structural racism, it won't be a completely foreign notion with words that have no bearing, but it will be something that we can really start to understand as a bigger community.
Closing the health disparities gap is like peeling an onion. There are many layers that contribute to the problem, from birth to old age. With growing awareness comes growing demand for action to remove historic, structural, and perceived barriers to the quality of health we all want as we grow older. To learn more and to see all of Nashville Public Television's Aging Matters series, visit wnpt.org/Aging Matters. Thanks for watching.
Major funding for Aging Matters is provided by the West End Home Foundation, enriching the lives of older adults through grant-making, advocacy, and community collaboration. The Jeanette Travis Foundation, dedicated to improving the health and well-being of the Middle Tennessee community. The HCA Healthcare Foundation, on behalf of TriStar Health. Cigna, together all the way. Additional funding provided by Jackson National Life Insurance Company, the Community Foundation of Middle Tennessee, and by members of NPT. Thank you.